Hi, welcome back to BT Wednesday morning on the BT Couch. The purple bracelets are out because we're talking about the 5th annual Rakhi Project from the City of Surrey. Colleen Kerr joining us alongside Sergeant Holly Turton from the Surrey RCMP. An important discussion, 5th year doing it. Tell us about this bracelet, the project, and what the big idea is here.
Absolutely. This is the 5th annual, as you've mentioned, Rakhi Project. It's actually a South Asian tradition that promotes love and respect. And ultimately, we're using it as a broader public education campaign to raise awareness on the prevention of domestic violence.
You know, domestic violence being the key here with the discussion. And Holly, let's talk about this. I mean, the complexities of the issue with domestic violence, we were just saying during the break, this is something that spans across different cultures, but how difficult is it to break the cycle for victims out there suffering from domestic abuse?
It is very difficult, and we appreciate that there are lots of barriers that they face, economic, emotional. There's just a variety of barriers. It's a difficult thing to leave and to try and start over. And we try very, very hard within the detachment and specifically in the domestic violence unit to try and provide them the support and some of those resources to make that easier.
And you know, as things get easier, you see the impact of community events like this. Colleen, what have you seen now that this is the 5th year, the discussions happening, how victims are stepping up, maybe sharing their story? What have you seen as the impact of the Rakhi Project?
Well, most interestingly, in the last week or so is one of our local reporters actually shared her personal story and actually divulged really for the first time publicly that she has been a victim as well as growing up in a situation of domestic violence, and it was very powerful and it was very difficult for her, but so many people have stepped around in support, and it was a really good indication that it's just happened. It can happen to anybody, you know.
You know,
yeah.
I've read this article, and when we have this discussion about domestic violence, the idea of isolation stands out. And this article is a prime example of someone saying you are not alone.
Yeah.
And, you know, when you're not alone in the process, the idea of the support you get is huge in this. The first responder role, tell us about this, because I mean, you brought some photos of some of the first responders out there. How crucial is this role for them, and what is the most important question to ask when they are dealing with victims?
The first responder role is critical. They are the first people who are intervening, and it's a highly emotionally charged situation, and they're really the first ones that are creating that relationship and trying to bridge that gap between what's just happened and the events that are going to occur that follow from it. It's a really difficult time for them, and we really want to be there to help them. And the most important question is, how can we help make you and your family safer? And that's our first priority.
Safety, and I guess building trust to you know, create that dialogue to move forward and break the cycle altogether. This was an initiative that started mid-July. It's going up till the end of August. Yes. What's planned now for the next 2 weeks in terms of events, exposure, awareness?
Well, essentially all of our point of sale locations, essentially these are $5, and they're sold at Fruitacana locations, at Save On Foods, as well as through the City of Surrey, and ultimately the proceeds go towards our Surrey Coalition Against Domestic Abuse, which culminates with a conference in the fall for service providers so that we can develop resources and better connections and collaboration among service providers.
And get that support network.
Yeah.
The website, once again, if people want to find out more for resources?
Yes, it's surrey.ca/crime reduction, all one word.
Perfect.
Excellent.
All right, there it is on screen. Ladies, thanks so much for taking the time today.
Thank you.